Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. Today, I am delighted to be joined by Marianne. If you're new to my podcast, welcome, because today we are on for a beautiful story. And Marianne, I am so grateful that you decide to join me today. And believe me, I recognize that it's not easy for a woman to sit in this chair and speak about their cardiac conditions. Not many of you are brave enough to sit down in this microphone, not because you don't want to do it, it's just that it's intimidating. And I know and I recognize it. So I'm grateful that you, even when you were nervous, you decided to, I'm going to go.
Yes. Well, I appreciate you asking me here today.
Awesome. And you are here today, not for me. You're here today for all the women that are listening to us, because your story is going to help save lives. No?
Yes.
When you came to me, Marianne, I thought that your story was very good to share, because when you came to me, your primary care doctor identified that you have some risk factors that could increase your risk for having a heart problem. How old are you now, Marianne?
69.
And looking fantastic. So don't be rolling your eyes.
Thank you.
So we started this journey in the early 60s. And tell me how you ended up in the practice. Why did you end up seeing a cardiology? I already said that your primary doctor sent you.
Yes, my primary sent me to you because of blood work indicating high blood pressure, high cholesterol, overweight, lifelong smoker. And she thought she heard a murmur.
Okay.
And so she said, it's time to come see you.
And you took her advice, which I think is super important for our audience, that so many times we might hear that a doctor suggests that you get a test or you get checked or you see another doctor, and we either don't ignore the recommendation, don't act on the recommendation, or think that it's not necessary. Yes?
Yes.
So many times, particularly when you're going to see a specialist or a heart specialist like me, it's like, but what is wrong with me? No? And then more often than not, why do we have to wait when something is wrong with us to go and get checked? And doctor, in this case, your primary care doctor was more about, like, she did this checkup and some things didn't look okay. So she's suggesting, this needs special attention. And a woman need to listen and do, and act, and you decide to act.
Yes.
So you came to me.
Yes.
So we ran tests. We recognize that you have multiple risk factors for heart disease. Now, you are postmenopausal. When you came and see me, you have high blood pressure already. You have high cholesterol, and you were an active smoker at that moment.
Yes.
Yes. So do you know then that cigarettes can be bad for your heart?
Yes.
Yes. Because we beat that so much. No, we just don't understand the magnitude.
Yes.
Yes.
Yeah.
So cigarettes increase the risk for cardiovascular disease. But interestingly enough, women tend to be more affected by cigarettes than men. So even though there is a risk factor for both of us, for women is a little worse because of the mechanism of heart disease in women.
Okay.
So we ran tests and we realized that there were some things that we were able to find. You already had disease in your coronary arteries, which is the arteries of your heart. We did a calcium score. That's how we knew that you have significant amount of plaque on those arteries. Mm-hmm. And then we ran tests. We ran the stress test. We did the echocardiogram. No other findings in there suggesting that the plaque was obstructing the flow.
Yes.
Yeah, so there was a lot of plaque, but it didn't seem to be obstructing the flow. Mm-hmm. And at that point, we said, okay, so let's work on focusing on smoking cessation. Let's try to modify what we can modify. No, at that point was, let's control your blood pressure. Let's manage your cholesterol. Let's quit smoking. Yes. Yeah, so focus on that. But What happened to you?
Well, I had a horrible 1-month-long vacation. I came back and my heart was just racing and pounding. And 2 days after getting back in town, I got up one morning after a terrible night of sleep. I went to Zumba thinking that I could relieve some of this stress and anxiety that had been building up. I attended Zumba for about 15 minutes and my legs would no longer move. I was feeling worse by the minute. I drove home. I got in my driveway and I waved over a neighbor to come see me. And she had had open heart surgery years before. And I just said, I think I'm having a heart attack. By then, my jaw, my shoulder, my neck, everything felt like it was just being pushed by a truck where, I would.
Is that when you recognized the heart attack? It was
Yes.
mostly when you started saying, wait a second, my arm is hurting.
My arm.
My jaw
Out
hurts.
here.
Okay. And then you're like, I'm definitely having a heart attack.
I think so.
What did you thought? Why were you thinking that you were anxious? Were you really anxious, like in your mind?
I was really anxious in my mind, like, am I going through what I think I'm going through? I was maybe in a denial state.
So when you went to Zumba, I said, I'm going to relieve this. I'm going to relieve this stress.
Yeah.
Were you really stressed?
Yes, because I had not been sleeping well. I had a month-long vacation that did not go well.
So you were really, really trusting, feeling like this is all anxiety and stress.
Yes.
Until physically your body were like, oh, no more.
No more.
And then at that point, you're like, uh-oh. But look at this craziness that we do as women. You drove yourself back home.
Yeah.
I feel terrible. I can barely move.
Mm-hmm.
I don't feel right, but I'm going to drive myself home, maybe take something and then go to bed.
Mm-hmm.
Yes, that is the typical behavior of a woman.
Of a woman. Mm.
So in this case, the symptoms got worse. Thank God that it happened on that driveway. So you can actually connect with your neighbor.
Yes.
And you realize that you were suspicious that you were having a heart attack. And luckily in your case, you were having what we call the typical symptoms of a heart attack. No, like a man will say, my arm is numb, my jaw feels numb, it's tight. A man is more likely to complain of that than a woman, although a woman can have it like you did.
Yes.
So it makes it a little easier to bring a red flag and say, I think I'm having a heart attack. So what happened then?
Well, my neighbor called 911. The ambulance was
The
there
proper
within
thing
minutes.
to do. If you think
And-
somebody's having a heart attack,
Yep.
we don't waste time trying to drive them to the emergency room.
No.
You get on the ambulance.
Got in the ambulance and they were taking my vitals. They were calling into the hospital saying this lady's in full
Yes.
cardiac arrest. And they asked me to chew a whole bunch of baby aspirins. And that's about the last thing I remember until maybe 2 hours later.
Got it.
Mm-hmm.
So we have great systems in the community where, and that's actually is nationwide, when the EMS identify that there is a myocardial infarction or a heart attack, they directly activate the hospital, letting them know we're coming with a patient that have a heart attack. And so that way they prepare the hospital and the staff to take that patient immediately to the cath lab so they can get the heart cath, so we can open the artery that is causing the
Yes.
problem. So in your case, all of that happened. You don't remember. You lost your consciousness. The next thing that you remember is you're already done with the procedure.
Yes.
Yes.
Mm-hmm.
So your heart did suffer from that heart attack. It got weak. Yeah. So do you have a weak heart muscle, and now you have blockages, and now we have a lot of questions to a lot of things to fix. To the point, and for the audience, cigarettes can cause a heart attack even if your arteries are open. In your case, they did found that you have multiple areas that have plaque, just like the calcium score show us. Not all of them were blocked, but definitely one of them was clotted. There was a clot in there that they had to remove and put a stent.
Yes.
That is how they took care of you.
Mm-hmm.
But whenever I see a smoker or somebody that is still actively smoking, I said, a clean bill that I'm giving you here doesn't mean that you're never going to have a heart attack, because as long as you put in cigarettes in your mouth, you're increasing your inflammation, you're increasing your risk for forming clots in your heart, spasm of your arteries, constriction of the arteries, high blood pressure. A lot of things are still happening in the body, even with a normal test. However, I do want to emphasize, which I think is important for the audience, that there's 2 points in here. The tests that we did on you are the only tests that have been developed. They are designed to detect heart disease in men, not in women, because they're looking for plaque. They're looking for plaque formation. They're looking for blockages, not necessarily looking for other mechanisms like a woman can present with when they're having a heart attack. So, and then also important to know that a normal test doesn't mean that you don't have anything. It's like a test can be normal, but if you don't feel right, you're going to keep saying that you don't feel right. In your case, you were not feeling sick when you came to see me. That's why we didn't pursue any other testing.
True.
You were not feeling sick.
True.
If you were to be feeling sick, then we're like, okay, so let's try to understand what is really happening in here. So you did know that cigarettes increase your risk for heart disease, just like it was just a hard habit to let go. But you did.
Yes, I did.
Yes, but you did.
I did.
And so after experiences like this, and we look back, and instead of saying, oh my God, I cannot believe, we said, okay, what can I do different moving forward? Yes. So now you got out of the hospital, you are on the right medications. How are you feeling?
I'm feeling wonderful. I really am. The breathing, I'm able to walk without losing my breath. Zumba, I'm fine. I'm back to Zumba where I can do an hour's worth. And enjoying life without a cigarette.
Very good.
Yes.
I'm so happy.
Thank you.
I know that, it's a habit. And like any habit is difficult to let go. And nicotine is an addictive substance.
Very.
But I feel that once you get to a process like you did, it's a matter of thinking about, is my life worth this cigarette?
Yes.
And, once you go through such a scary moment, it's like, is it worth it?
Yeah.
Yes.
Are we still taping?
Yes.
I just wanted to say something. My husband died of a heart attack on our bed, and he was a heavy smoker. And that was in 2017. And it still wasn't enough of a calling card for me to put in my head, hey, it's time to quit.
Wow. But you know what? Sometimes it's like that. It's like, you will think it's like my own husband died in my bed. He was a heavy smoker. And you're like, you got to let go of those cigarettes. But sometimes you have to have very dramatic moments that it has to touch you.
Exactly.
You. Yeah.
Yeah, me.
Because like, for example, we talk about these cigarettes every day, night and day. And patients are listening to us. It's up to them. It has to be their experience. But
does.
I hope that the audience, the women that are listening to us, or the audience, realize that, yes, it's easier said than done. But we have somebody here that smoked for how many years?
50
years. And now we are on the little amazing journey of another 50 years with no cigarette.
Exactly. Exactly.
And it's possible. No, so sometimes we think that, oh, this is impossible. Like I try. And we said, no, it is possible. So what would you, if you can use your story to empower a woman, what would you say to her? Be a friend or be a neighbor? What would you say to her so she doesn't end up where you did?
I would say to look yourself in the mirror, have a good long talk with yourself, change things you can change, believe you can change things that you want to change. Don't give up.
I love it.
That's what I would say.
That's actually amazing. Yes. For the audience, I want them to know that it takes a very, not only much commitment, but a strong woman like you to go through this journey and then still say, I have the power is in me.
Yes.
And I'm going to commit to myself. So many times we put ourselves in the back burner. We don't prioritize ourselves. And until you do that, then it's going to be very hard for any system to take us seriously. If we don't take ourselves seriously, so then who is going to take us seriously?
True.
So a few things that I wanted to share with the audience before we say goodbye is, if you are at high risk for heart disease and your doctor is suggesting that you get checked, please get checked. If you know that you're at high risk for heart disease, and please look what those risks are. We mentioned a few of them here. You're postmenopausal, that is a high that you already have a risk for heart disease. If you have high blood pressure, high cholesterol, you have diabetes, you have a family history, if you are a smoker, if you have gestational diabetes when you were pregnant, if you have preeclampsia, all of those are risk factors for heart disease. If you have any of them, get checked. Do not wait until something is wrong to get checked. Now, for the ones that are experiencing symptoms and their doctor told them that the tests were all normal, I want them to listen to your story and learn that a normal test doesn't mean that everything is okay. They had to continue saying something doesn't feel right until they get to the bottom of it.
Yes.
Okay? And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.